SAMHSA's concept of trauma and guidance for a trauma-informed approach. Prepared by SAMHSA's Trauma and Justice Strategic Initiative, July 2014. Part 5. Guidance for implementing a trauma-informed approach. Developing a trauma-informed approach requires changes at multiple levels of an organization and systematic alignment with the 6 key principles described above. The guidance provided here builds upon the work of Harris and Follett, and in conjunction with the key principles, provides a starting point for developing an organizational trauma-informed approach. While it is recognized that not all public institutions and service sectors attend to trauma as an aspect of how they conduct business, understanding the role of trauma and trauma-informed approach may help them meet their goals and objectives. Organizations across service sectors and systems are encouraged to examine how a trauma-informed approach will benefit all stakeholders. To conduct a trauma-informed organizational assessment and change process, and to involve clients and staff at all levels in the organizational developmental process. The guidance for implementing a trauma-informed approach is presented in the 10 domains described below. This is not provided as a checklist or a prescriptive step-by-step process. These are the domains of organizational change that have appeared both in the organizational change management literature and among models for establishing trauma-informed care. What makes it unique as establishing a trauma-informed organizational approach is the crosswalk with the key principles and trauma-specific content. 10 implementation domains. 1. Governance and leadership. 2. Policy. 3. Physical environment. 4. Engagement and involvement. 5. Cross-sector collaboration. 6. Screening, assessment, treatment services. 7. Training and workforce development. 8. Progress monitoring and quality assurance. 9. Financing. 10. Evaluation. Governance and leadership. The leadership and governance of the organization support and invest in implementing and sustaining a trauma-informed approach. There is an identified point of responsibility within the organization to lead and oversee this work, and there is inclusion of the peer voice. A champion of this approach is often needed to initiate a system change process. Policy. There are written policies and protocols establishing a trauma-informed approach as an essential part of the organizational mission. Organizational procedures and cross-agency protocols, including working with community-based agencies, reflect trauma-informed principles. This approach must be hardwired into practices and procedures of the organization, not solely relying on training workshops or a well-intentioned leader. Physical environment of the organization. The organization ensures that the physical environment promotes a sense of safety and collaboration. Staff working in the organization and individuals being served must experience the setting as safe, inviting, and not a risk to their physical or psychological safety. The physical setting also supports the collaborative aspect of a trauma-informed approach through openness, transparency, and shared spaces. Engagement and involvement of people in recovery, trauma survivors, people receiving services, and family members receiving services. These groups have significant involvement, voice, and meaningful choice at all levels and in all areas of organizational functioning. Example: program design, implementation, service delivery, quality assurance, cultural competence, access to trauma-informed peer support, workforce development, and evaluation. This is a key value and aspect of a trauma-informed approach that differentiates it from the usual approaches to services and care. cross-sector collaboration. Collaboration across sectors is built on a shared understanding of trauma and principles of a trauma-informed approach. While a trauma focus may not be the stated mission of various service sectors, understanding how awareness of trauma can help or hinder achievement of an organization's mission is a critical aspect of building collaborations. People with significant trauma histories often present with a complexity of needs crossing various service sectors. Even if a mental health clinician is trauma-informed, a referral to a trauma-insensitive program could then undermine the progress of the individual. Screening, assessment, and treatment services. Practitioners use and are trained in interventions based on the best available empirical evidence and science, are culturally appropriate, and reflect principles of a trauma-informed approach. Trauma screening and assessment are an essential part of the work. Trauma-specific interventions are acceptable, effective, and available for individuals and families seeking services. When trauma-specific services are not available within the organization, there is a trusted, effective referral system in place that facilitates connecting individuals with appropriate trauma treatment. Training and workforce development. Ongoing training on trauma and peer support are essential. The organization's human resource system incorporates trauma-informed principles in hiring, supervision, staff evaluation. Procedures are in place to support staff with trauma histories and/or those experiencing significant secondary traumatic stress or vicarious trauma resulting from exposure to and working with individuals with complex trauma. Progress monitoring and quality assurance. There is an ongoing assessment, tracking, and monitoring of trauma-informed principles and effective use of evidence-based trauma-specific screening, assessments, and treatment.